Hello, I'm Joel Shepard. I'm an Eldoa spinal therapy trainer here at the Pacific Clinic. So Eldoa is really good to relieve back, neck, shoulder, hip, pelvic, or rib pain in your body. And basically what we do is we use global tension and activate your muscle to create space in a targeted joint. All right, when I talk about targeted joint, we have an Eldoa exercise for every vertebrae from C2 all the way down to your coccyx and any of the joints that affect the spine, to include the hips, the pelvis, the ribs, and the shoulders. Okay, so what we do is we isometrically create space in those joints, and when we use your muscle to create that space, it demands fluid, so we're rehydrating those tissues. And if we're speaking about the vertebrae, we're going to be rehydrating those discs in between those vertebrae. Your discs are made up of 80% water, and water can't be compressed. And as we get older and gravity starts making us compress a little more, or we have some type of trauma or some neglect of our body, that compression starts to weigh heavy on that disc, and that water can't be compressed, so it starts to leak out, minimizing that cushion, or sometimes it actually pushes that disc outside of the vertebrae, which is known as like a herniated or a bulging disc. So when we create space in those vertebrae or in those other joints, it allows the rehydration, it allows recentering of those discs, and most of our clients feel immediate relief in these Eldoa exercises, all right? They felt something snap back into place, whether it was in the pelvis, the shoulder, the vertebrae somewhere. They have this great feeling. And not only is it immediate relief, many folks feel better the next day or two. And the great thing about Eldoa is it is a self-therapy tool. So as I work with you, I'm teaching you how to take care of yourself. When we find the Eldoas that are working for you, we teach you and arm you with that. So then after a few sessions, you now have the tools every day to take care of your own body, to reset your own joints, and to keep them healthy, keep them strong, and keep them in the right place. Many of my clients that I'm working with now, if they're going to physical therapy, some of them have been suggested for a second spinal fusion or a second surgery, and they wanted to give it a shot to avoid some of those things, and they felt immediate relief and sustainable relief with that. So if you're interested in relieving some of that pain and learning some Eldoa exercises, all you gotta do is come to the Pacific Clinic or give them a call, give me your name and number, leave it there, and then they'll leave that message with me and I'll call you back and we'll get together and we'll solve some of those problems for you.